into drug use for some reason or another at some point in their life, or you know somebody, once you are in there, what options are there for you? Is it all or nothing? Is it that there is no hope when you go in? The answer is no, there is hope. There's something which can be done. And I'm here to give you that hope and to tell you what exactly can be done about this substance use problem. So basically, substance use disorders are treatable and they are preventable. And that's why we are here first to encourage that we prevent them from happening. But once you get into the substance use problem, there is hope for you. And why? Because there's been a lot of research. And as specialists in this area, we have understood how the brain works. We have understood how drugs affect your life. And now we know how we can successfully treat you. And these treatments are in various categories. So there is use of medication. We can use medication, what we call detoxification, to clean up the drugs which have gone into your system. We can use behavioral interventions, talk to you. You've been invited and have passed through your counseling center. I have seen how beautiful it is, very therapeutic. When we come there, we can talk to you and let you know the right way to deal with things. And then we can also help you form peer support, that you have other people to work with you. So the treatment of substance use disorder is not, it is individualized, but it addresses the whole person and their needs. And why should people be treated? First is that we reduce the major symptoms of the problem of substance use. When you are using substances, there are some consequences. There are things which happen to you. And that's why we are starting by detoxifying your body, because it's going to affect the way your body functions. So you need to reduce those major symptoms. In the process, then we will improve your health and your social functioning. So it's important to get treatment, because even if you sink down, and we have seen people, especially students, who will not complete their education on time sometimes, some who even drop out, others who struggle a lot. But when they get into treatment, they come back and pick up on their education and they continue. That will have improved their overall health and their functioning, social functioning. And then this is also helps to teach and motivate individuals on how not to go back to the substance using behavior. You learn a lot when you come for treatment. So what is the overview of treatment? What happens? First, we have what we call early identification. When you are using substances of abuse, drugs, alcohol, and other drugs, you need to identify that this is a problem early in your life. Because if you start early, then you seek help early, then it is easier. The treatment outcome is better. It is easier to get out of that problem. So early identification and screening is very important. And I'm very glad that USIU is taking substance use very seriously. We have been here actually since Tuesday, giving information. That information also helps to screen, because you can look at yourself and see, is my use going overboard? You will talk to professionals. While we are here, we are also screening. The information we are passing to you, you can look inside and see, do I need help? And once you have been identified, then you are given options for how you can be helped. And part of the options is visit your counseling center, and while they are there, they will link you to the various services you can receive from service providers. I'm also very happy that USIU is connecting with service providers. Like you've been told, we run the Fountain of Hope Treatment Center. This is a mental health hospital. And we collaborate with USIU in several areas. We have had your students actually come to our center for their practicum. So that is part of the way we are helping. If you didn't know that there is help, then when you come, you can take that message. Those who need treatment, we also give treatment. And now we are here doing sensitization. This is sensitizing you on the need and what can be done. So that is about early identification, screening, and then we can do what we call brief intervention and then link you to care. The other thing we can do, it's about comprehensive screening. For people who screen positive for drug use problems, then we do a comprehensive intervention assessment. We look at yourself holistically. We look at your mental well-being, your psychological well-being, your psychiatric well-being, your social well-being, and we see if you have any social stressors or you have psychological problems. Sometimes people use drugs because they have mental health problems, actually. You are depressed, and you realize when you use a certain kind of drug, you feel better. So when you come for a comprehensive screening assessment, then we are able to pick that out, and when you are started on medication, you get better. So this is important, and it is part of the treatment option which is available. There are people who have sunk deeper into the problem. So part of the treatment they can be given is stabilization. Like you're saying, you come to a specialized center, like the Fountain of Hope Treatment Center. After we've done this thorough assessment on you, we realize what the issue is, and then we can stabilize you. Like starting by doing what we're calling detoxification, using medication to stabilize your body, just to clean the substances out of your body, to take out that discomfort. Some people will be shaking, some people will be agitated, others they cannot sleep because they have withdrawn the substance your body has been used to. So you are stabilized, and that way then we can go ahead and treat you for you to get better. The other area is timely and appropriate substance use disorder treatment. Now here we use psychotherapy, we use peer support, and we use all the available practical therapeutic means to get you stable and back on your feet. And the other thing is to link you to continued care, because when you're in substance use, you need to continue getting support. We will link you to where you can get what service. We have support groups which you form in the area of rehabilitation, or we have other meeting areas which you can attend, and these ones are taught to you as part of treatment. So we're looking at the spectrum of treatment services. What does it involve? And like we have said, first, there's that what we are calling screening. Once you're screened, then we do a full assessment to see what your areas of need are. Once we do that full assessment, then we will have a treatment plan depending on the areas we have identified. Like you said, some people, we find upon assessment that they are using drugs actually because they have a mental health problem. This person has a mood disorder. They are anxious, and they have realized that when they use a certain drug, they actually feel better. So they are abusing like drugs like Valium or other prescription medicine. So when you come and that is identified, then you are given the right kind of treatment, then you get better. So we plan your treatment according to your needs. There are some people who will get into drugs because of the family situation. They do not have very supportive family system. So we also come work with the family. We link you back to the social networks, and then you get better. So a treatment plan is made for you and with you actually, and it is very individualized. So you find like 10 people in a rehabilitation center, but everyone is being addressed, their medical needs and their needs. Then the other one we do is psychotherapy. We give psychotherapy where we give psychological interventions to help you to stabilize. And like we have said, then we have continued care. While we are there, we also address other issues. There are other issues which come, Because if it is a student, for example, sometimes they have been sent out of school because they were not doing well. So most of the time we find such a student will need a letter explaining to the institution that they were actually sick, that's why they didn't do well. Now they have been treated and they are fit to go back to class, and also prescribing that they can be linked to the counseling department and be supported. We have received people who have been dismissed from their work because they missed work or they were underperforming and they were not meeting their work obligations. So we also write to their employers explaining this person was actually sick because substance use is a medical problem. It's a medical problem, and it should be taken as such. It's not like something somebody does because they are weak or they have poor morals or they have no self-discipline. Like we're saying, sometimes you actually have a mental health problem and you get there. So we are able to link employees to their employers and they go back to work. The other thing we do, you find people are using substances, before they get into treatment, they have severed all their social relationships. So sometimes we also link families. A child had run away from home, and then in treatment, we'll bring them back, and we bring the family back, and we connect them. Sometimes people have been brought to the rehabilitation center from the law enforcement. They have been brought by the probation officers. So we'll also write a letter that this person has been treated, and now they can be supported in the society to integrate back to the society. So this care is all holistic. It's not just about the substance use. The treatment approaches we use are family-centered, because we say addiction, being a brain disease, affects the whole family. We say sometimes you find, like now you brought your child to a university like this one. You are hopeful this child will finish in about 4 years and they come out. And you realize in their second year or their third year, they have actually not progressed past first year. So you can imagine the frustration in that family. All the expenses, the hopes they are put in this child. So it affects the whole family. So recovery has to happen in that family setup. We also have to deal with the parents. We have to deal with the siblings. Bring them together and help them in part of the treatment. So when we are treating, we treat you as the patient who is there, but we also treat other people who are around you who have been affected by your substance use. So people need to understand how treatment progresses and why you need to get engaged in the treatment process. First, and this is a question which has been asked many times. Most people who are in substance use or in addiction, they are very resistant to getting help. First, because they do not think they have a problem. And if there's a problem, they tend to minimize the problem. It's not that big. I will deal with it. I will stop when I want. So what happens? Some people will think, now if this person is not willing to seek help, even if we bring them for help, will they benefit? And the answer is yes. Please help them get into help where they can be helped. Once they are there, using the psychological mechanisms we have, we help them to begin understanding that they have a problem, and it's a big problem, and it's a problem that can be solved, that can be helped. Because we started by saying addiction is treatable. You can treat it and the person goes back to functioning. So the worst you can do is to fail to help this person to seek help because you think they are not going to be engaged. Once they get there, we are going to work with them for that they participate in the treatment. The other thing is they are going to gain knowledge about their substance use. Because when you are using substances, your brain is clouded. You're not thinking. Substance use actually affects your thinking. One of the main areas it knocks off is your thinking brain. So you're not thinking. Just by coming there and being sober, not using drugs, it clears your brain to start thinking, and then you can start reasoning. The other thing is we are encouraging you to participate in support systems. You find like people come to the rehabilitation centers, it's actually other clients who are persuading them. I was like you. I was thinking like you. But now I have realized actually this is a problem and I feel much better. That works wonders most times, more than when they are being persuaded by their family members. And because of this now, for the period they are in the rehabilitation facility, they are not using drugs, so they are abstinence. So that period also helps their body to recover from the substance use. It also helps them gain their health back. It helps them to refocus. They can start now reasoning and meditating and thinking about their life. They also eat better, because when they are out there, they're using substance. One of the main things which suffers is nutrition. They don't have time to eat. And even when they eat, their bodies do not absorb the nutrients they get. So, and then even when they eat, their eating is very erratic. They are not eating healthy. So you come to the rehabilitation, one of the main things you get is nutrition, good nutrition, and the body improves. And that way also your reasoning also improves, and you are able to gain the benefits of treatment. And with this, we link you to support groups, and this helps you to prevent relapse. So this is very important. Once people have completed their treatment period, engagement, then we appraise the goals, how we have achieved the goals of treatment. Those things we had set, the goals we had set earlier when we started. And you can see this person now has gained the skills to live a sober life. They are stabilized, their medical challenges have been taken care of, and now you have connected them to support system, so they are ready to gain and to join the main society. So we say what do we expect post-treatment is that recovery is a lifelong journey. Once you have been in substance use, then you have to be very intentional about your life, and I know this will be discussed in detail. You have to take it every day at a time as it comes, because you need that ongoing support and your mental presence. So people need to be connected, to connect back to their society. If you had lost your job, like I said, we help you to get back to job, to get back to school, to connect you with your social support, so that you are able now to interact and to contribute meaningfully to the major society. So these alumni groups are very important. Support groups are very important. Education, employment, finding safer housing is very important for people once they have left the treatment facilities. So this is the liaison is one of the major things we do to help you get back to society and to integrate and to guide you up onto the way of living a sober and more meaningful life as we go on. So thank you very much for your time. I will end the discussion there.